Medical news from Lancet, London, England. Temocillin versus carbapenems for bacteraemia due to third-generation cephalosporin-resistant Enterobacterales in Spain. Astarta multicenter, Phase 3, open-label, non-inferiority, randomized clinical trial. Temocillin proved just as effective as carbapenems for treating bloodstream infections caused by third-generation cephalosporin-resistant Enterobacterales, offering a narrow-spectrum alternative that could spare the broader-acting carbapenems from overuse. In a head-to-head trial, the cure rate was virtually identical, and safety outcomes were comparable, suggesting temocillin can be deployed without compromising patient outcomes. The rise of 3GCR Enterobacterales has forced clinicians to rely increasingly on carbapenems, intensifying selective pressure and fostering resistance. Yet few agents with activity against these organisms have a narrow spectrum, and the evidence base for such alternatives remains thin, prompting the need for a rigorously designed comparison. The ASTART trial was a multi-center, Phase 3, open-label, non-inferiority randomized study conducted across 29 Spanish hospitals between December 2020 and November 2024. Adults with monomicrobial bacteraemia due to 3GCR Enterobacterales susceptible to both temocillin, 2G4 every 8H, and a carbapenem, meropenem 1G4 every 8H or ertapenem 1G daily when appropriate, were randomized 1:1, with stratification by prior active therapy and infection source. The primary endpoint, clinical success by day 28, defined as cure without drug discontinuation, no recurrence, and survival, was assessed in the modified intention to treat (MIT) cohort, which included all patients receiving at least one dose. A 10% non-inferiority margin was pre-specified, and no patients were lost to follow-up. Of the 334 screened participants, 328 entered the mid-analysis, 163 temocillin, 165 carbapenems. The cohort was elderly, median age 72 years, and burdened with comorbidities, median Charlson Index 2. Clinical success was achieved in 120 patients, 74%, receiving temocillin and 121 patients, 73%, on carbapenems, yielding an absolute difference of 0.3%, 95% CI 7.7% to infinity, and a non-inferiority p-value of 0.017, thereby meeting the predefined margin. Serious adverse events occurred in 31 patients, 19%, with temocillin versus 35 patients, 24%, with carbapenems, indicating a comparable safety profile. Subgroup analyses stratified by infection source and prior active therapy showed consistent efficacy across categories, and no missing data were reported, reinforcing the robustness of the findings. These results support the incorporation of temocillin into therapeutic algorithms for 3GCR Enterobacterales bacteraemia, offering a carbapenem-sparing option that aligns with antimicrobial stewardship goals. Clinicians can consider temocillin as a targeted, narrow-spectrum agent without fearing inferior outcomes, and guideline committees may revise recommendations to include temocillin as an alternative first-line therapy in appropriate settings. Nevertheless, the open-label design and the restriction to Spanish hospitals may limit generalizability. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.